Ah, the ocean. Beautiful, isn't it? But this isn't just any ocean. This is your ocean, composed of your life experiences, values, and beliefs that keep you afloat while you sail through life. But not all days are easy for sailing, and sometimes you get caught out on a storm at sea, and the waves may become overwhelming as they come crashing down, and you don't know how to navigate out of the storm safely. You don't know how much longer you can hold on, as it feels like the storm will never pass. But eventually, it does pass, but unfortunately is left to shipwrecked, feeling isolated and lost. Hi, my name's Corinne, and today I'm going to be talking about the Tidal Model as part of my coursework for Philosophical and Critical Foundations in Nursing. So the Tidal Model is a recovery and therapeutic relationship-focused nursing model developed by Phil Barker and Buchanan Barker for psychiatric nursing. This ocean scenario that I just described is a metaphor for the experience of living with mental health and illness, which is a central component to the Tidal Model, and where the model gets its name from. From this metaphor, one is meant to appreciate the nonlinear experience of life in the journey of recovery through the imagery of the constant change of the ocean, most easily observed through the ebbs and flow of the tide. So far, I've described the experience of mental health crisis, or what the model would refer to as a storm at sea. But now that we're stranded out on this deserted island, what is next? How do we get safely back out to sea? So, according to the Tidal Model, nurses approach this by understanding each individual's narrative, recognizing their strengths, and empowering patients to navigate through their own recovery. The belief is that each person has the insight and knowledge to identify what they need through self-exploration. This is a departure from the paternalistic approach in medicine, where there is a power imbalance between provider and patient. These values of the Tidal Model are reflected in the 10 commitments. The model uses the term commitment to reflect the commitment to change that needs to occur by both the helper and the person in need of help. Each commitment has 2 corresponding competencies which demonstrate how to uphold this commitment. For example, commitment 3, become the apprentice. This commitment is referring to the act of recognizing the patient as the expert of their own experience. The provider can demonstrate being the apprentice by 1, developing a care plan based on the person's needs and wishes, and 2, help the person identify specific problems of living and what might be done to address them. So basically, that's the Tidal Model in a nutshell, a recovery-based model with a focus on empowering the voice and the experience of individuals as they identify their needs and strengths as they make their journey through recovery. So if I ever had the opportunity to meet with Phil Barker and Buchanan Barker, perhaps let's say over lunch, I would have a couple of questions about the reality of the application of the Tidal Model. I am a psychiatric nurse and I work in psychiatric emergency, so basically I'm stationed at Shipwreck Island. And while there are certainly patients where the model is an easy application, there's a few scenarios that I can think of where it might be a little bit more of a challenge to get anywhere productive with it. One of the first things that comes to mind is working with youth. And I love working with adolescents, but they can be some of the most challenging patients to work with. For example, imagine a 13 to 16-year-old female who is brought into the emergency department by police after getting into an altercation with her mom and threatening to kill herself. While assessing her, she's apathetic to the whole situation. She's just stating, I don't know, to the questions being interviewed. And it gets to just the point, I'm not the one that should be here. It's my mom, she's the crazy one. So in the Tidal Model, one of the competencies is use the available toolkit, which is what we are doing when we are going through our history of experience and figuring out what worked for us in the past. Now with our youth, they don't really have that experience to know what has worked in the past because this might be a whole new experience for them. So according to the Tidal Model, when you're in a situation like this, the nurse should use just best practice expertise to help the patient out. However, because youth are so systematically disempowered with a lack of autonomy, how do you balance this youth patient voice with your help providing expertise, as well as the possibly conflicting wishes of their parents? This scenario also presents the challenge of working with patients who are not providing much of a meaningful engagement, accountability, or insight. One of the recommendations as part of the Tidal Model is the importance of being patient and persistent. Given the limited amount of time we have in the emergency department to spend with patients before they are discharged or transferred up to the unit, what is that balance then between patience and persistence? Also, thinking about the limitations in the emergency department when it comes to care planning, We might be able to make some leeway on the self-exploration and solution identification depending on the patient. However, we can't guarantee continuity of this Tidal Model's application when a patient is transferred to the inpatient unit or discharged back to their community providers or even into the care of their parents. How do you mediate this from our limited point of contact in the emergency department? Even though I do have questions about the application of the Tidal Model in reality, I do think that the Tidal Model is a good framework for patient-centered care in recovery. And I do think more organizations should look into integrating this model into their care systems to improve quality outcomes for our psychiatric patients. I hope you enjoyed learning about the Tidal Model today and that you learned something new. Thanks for watching.